How can you conceive with high levels of prolactin? What is prolactin, by the way? Do you know that many women in the world have failed to get pregnant just because they have high levels of prolactin? In this video, let's look at what causes high levels of prolactin and how can someone get pregnant, how can you conceive even when you have high levels of prolactin. Watch.
Ask Dr. Uthuman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthuman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me, to have a private conversation, a private chat, to have that private consultation when nobody is aware of your problem, go to my website www.druthuman.com and book an appointment. I'll be there to chat with you. We find a way forward to your problem. Don't worry, my website has been down and most of you that had made appointments, I'm sorry I disappointed you, but this time around it's been restored and we are live there. Go there, make your private appointment. I'll be there to answer you. We shall chat and your problem will get solved. Follow me on all our social media platforms. The name is Ask Dr. Uthuman. Today we have a very important topic. A very important topic, and I want everyone to be very attentive. Put down whatever you're doing and listen. Watch carefully. What are we talking about today? We are talking about a monster that is making many women in the world fail to conceive. A monster that can make you fail to conceive. This is one of the reasons why most women have failed to get pregnant. This monster is here. It's called high levels of prolactin. Who helped us to discover this topic is called Ado Justina. She asked her question. She said, please sir, can you talk about high levels of prolactin? And she even pleaded, she put these signs, pleaded, please sir, can you talk about high levels of prolactin? Now, let's first understand what prolactin is. Prolactin is a hormone that is found in our bodies. Actually, it is found in both males and females. What is the role of this hormone? This hormone is the one responsible for the development of your breasts. It is the one responsible for forming your chest to make sure that the woman's chest is different from the man's chest. So breast development is done and procured by a hormone called prolactin. This hormone is so dear that it is also the one responsible for lactation. What is lactation? I mean breast milk secretion. In other words, when you conceive and give birth to a child, that child has to suckle milk. Where does milk come from? There are a lot of ducts. There is a process through which someone passes through in order for milk to come out. But the hormone responsible for that process is called prolactin. And prolactin is also, this prolactin is also regulated. It has its master, the pituitary gland in the brain. Now, I don't want to put you there, but I want to understand that prolactin is a hormone in the body responsible for breast development. It is also responsible for lactation or milk secretion. But also, we can also get to know that prolactin is also responsible for homeostasis. What is homeostasis? This is something they are asking us in our O-level science. Homeostasis, self-body regulation. The process by which the body self-regulates itself. Like the body is able to regulate its temperature, the body is able to regulate its whatever is in the body. And that is homeostasis. So prolactin also helps us achieve that. But now, this is not the reason as to why we are here. We are here because of the reproduction. And that is the other issue of breast development and also the issue of lactation. Someone is going to ask themselves, how can a hormone responsible for producing milk, a hormone responsible for breast development, stop me from conceiving? How is breast development and breast milk secretion, how is it related to conceiving? That is the big question I know you have. Now, this is it. This hormone, prolactin, is one of the many fertility hormones, and they interact. So this interaction is what is going to cause the problem. By the way, if we say high prolactin or low prolactin, what do we mean? We need to first understand the normal levels. So a non-pregnant woman is supposed to have at least 25 nanogram. So the hormone, the prolactin is not supposed to go beyond 25 nanogram. Then a pregnant woman is supposed to be having between 80 to 400 nanogram per milliliters. Why? Because if someone is pregnant, they are preparing to give birth and the baby will have to suckle. So we need breast milk. Therefore, the levels of prolactin have to go high in order to secrete breast milk. By the way, do you know that we also have prolactin in males? In men, we have prolactin in men, small. Prolactin in men is responsible for secretion. It assists in the secretion of testosterone. Actually, it also stimulates the proliferation of some cells, very important cells in the central nervous system. Those cells are called oligodendrocyte precursor cells. These cells are important in the cell's development. This is not the topic of the day. The topic of the day is prolactin vis-a-vis pregnancy. So now, we are seeing that during pregnancy, the levels of prolactin are high. They go to between 80 to 400. When you're not non-pregnant, they are below 25 nanogram per milliliter. Put that aside. How is prolactin going to affect other hormones? Because we know that we have the hormone of pregnancy, which is progesterone. We have the hormone called follicle-stimulating hormone that is responsible for stimulating the ovary to, in other words, it's the one responsible for proliferation, for maturation of the egg. If you don't have a matured egg, you cannot conceive. There is another hormone called luteinizing hormone responsible for moving, for transporting, to aid the transportation of the egg from the ovary to the fallopian tube. So I think you're now seeing where I'm going. You have a hormone, follicle-stimulating hormone, responsible for maturation, proliferation of the egg. Remember, at birth, you're born with eggs. They are primordial follicles. They are just there. They are not mature, but they are eggs. A hormone called follicle-stimulating hormone is responsible for maturation of this egg. A hormone called luteinizing hormone is responsible for transporting this egg from the ovary to the fallopian tube where fertilization is going to occur. A hormone, progesterone, is responsible for maintaining the pregnancy. Now, if you have high levels of prolactin, you're going to have low levels of progesterone. If you have high levels of prolactin, that's why someone was asking about that they are having high prolactin. If you're having high levels of prolactin, you're going to have low levels of estrogen. Worst of all, if you have high levels of prolactin, you're going to have low levels of follicle-stimulating hormone. This is where the disaster comes from. You have high levels of prolactin, low levels of follicle-stimulating hormone. What is the reason? Why do we have follicle-stimulating hormone? The reason as to why you have follicle-stimulating hormone is to proliferate, is to cause maturation of this egg. If you have high prolactin, it is going to cause a negative, it is going to decrease the levels of follicle-stimulating hormone in the body. When the levels of follicle-stimulating hormone, when the levels are low, the eggs will not be matured, and therefore it will be impossible for it to conceive. High levels of prolactin will also cause a decrease in the levels of luteinizing hormone. So if luteinizing hormone is low, of course, the egg will not be transported, will not be aided to move from the ovary to the fallopian tube for fertilization. Are you seeing how high prolactin can cause infertility? So what we are trying to mean is that prolactin alone cannot make you fail to conceive, cannot cause infertility. But what it does is to affect the other hormones. these hormones interact. So because we've seen that high levels of prolactin will cause a decrease in the follicle-stimulating hormone, and the follicle-stimulating hormone is responsible for the maturation of the ovum. Can you conceive with high prolactin? No. We've also seen that high levels of prolactin will cause a decrease in the levels of luteinizing hormone, LH, which is responsible to assist the movement of the egg or the ovum from the ovary to the fallopian tube at the region of the ampulla for fertilization. Therefore, that will not happen and someone will not be able to conceive. So, if actually this prolactin is very serious by now, because we've seen that it is now going to cause infertility. It doesn't only cause infertility alone. There are also other effects of high levels of prolactin actually. But you should also know that even when prolactin is very low, if it is very low, we are going to have effects. For example, we are going to have delayed puberty. We are going to have delayed puberty. We are also going to have infertility. We shall also have infertility when we have low levels of prolactin because, of course, there is delayed puberty. And there is also menstrual disorders. But now, that is not too much. For low levels of prolactin, it's not a very, very big issue. The biggest issue is on high levels of prolactin, which we've seen up. I just wanted to also bring out of that. Someone may also ask themselves, what if I have low levels of prolactin? But high levels of prolactin, this is where we have a problem. High levels of prolactin. You have high, even if you fail to understand everything here, understand this, that if you have high levels of prolactin, they are going to increase the levels of follicle-stimulating hormone. Therefore, you will not be able to mature. Your egg will not be able to mature. High levels of prolactin is going to cause a decrease in the levels of the luteinizing hormone, which is a hormone responsible for movement or transportation of the egg from the ovary to the fallopian tube at the region of the ampulla for fertilization. Therefore, high prolactin causes infertility. But we must find a solution for it. How will you know that you have high levels of prolactin? A person with high levels of prolactin will have galactoria. Usually, when a woman comes to me and they are talking about infertility, I've spent this number of years without having a child. My last born is 12 years. I have never conceived. I've looked for a child from all the angles. Some people even reach an extent of going to the witch doctors to look to get a child. When a woman presents to me, I check if they have galactoria. I also ask if you have galactoria. What is galactoria? Galactoria is when a woman is able to separate breast milk when they are not pregnant, when they are not breastfeeding. A non-breastfeeding, non-pregnant woman having breast milk. You just press on a woman's breast and the breast milk fluids are coming out. That is called galactoria. So that is one of the major signs of high levels of prolactin. There is also what we call secondary amenorrhea. What is amenorrhea? Amenorrhea is lack of periods. Is when a woman is not able to see their periods. You'll find a woman telling you, I have never seen my periods. I've never seen blood in my, I've never undergone menstruation in my life. That is called primary amenorrhea. But there are those who have ever seen, maybe at 15 years or what, they started menarche. They started having menstruation, but then as time went on, at 30 years, 45 years, they are no longer seeing menstruation. Or even, they see menstruation after a year or even 6 months. People who skip periods, we call that secondary amenorrhea. You've ever had menstruation, but currently you're not undergoing menstruation. So we call that secondary amenorrhea. And high levels of prolactin is a contributor. Why? Go back to where we're talking about the interaction of this prolactin with progesterone, with estrogen. You'll understand why you're not having periods. There is also what we call anovulation. Anovulation, you'll find a woman is having periods. They're having periods, but they are not having ovulation. In one of my videos, I talked to you about the signs of ovulation. whereby someone has that the discharge. We talked about it, how it looks like. I think everyone knows that pain, the small pain that comes during ovulation, all the signs, the excitement, the urge to have sex, everything. We talked about signs of ovulation. If you've not watched that video, please check it out. I have it there. And we dissected the signs of ovulation. Now, there are women who do not undergo that. There are women who cannot, because you see, during ovulation, a woman is highly active. They really feel like they should. They are very active. They on heat. They want to have sex. There are women who never have that period in life, and that is called anovulation. There are women who don't undergo ovulation. How will you conceive when you're not ovulating? Do we know ovulation? Whoever has been watching my videos knows ovulation. We said it is a process whereby the egg moves from the ovary to the fallopian tubes and the region of the ampulla for fertilization. That is ovulation. So there are women who undergo menstruation but do not have ovulation. We call that anovulation. And one of the contributors of this, high levels of prolactin. Why? We said that high levels of prolactin will cause a decrease in luteinizing hormone, which is a hormone responsible for ovulation. Of course, infertility. If you find yourself not conceiving when you're having unprotected sexual intercourse, just know that probably one of the issues is high levels of prolactin. Now, very funny that one of the signs of ovulation is decreased or reduced shaving frequency. If you find yourself that maybe you used to shave every after a month, or you used to shave, I know you know the parts I'm talking about, the parts for shaving. You used to shave, not the hair, this hair, but you used to shave every after a month, every after 2 weeks, every after 3 months, whatever your cycle was, the frequency was. If you find yourself that the frequency has reduced, you used to shave twice in a month, you can now even go for 3 months without shaving. The hair is not all that growing. That's a sign of high levels of prolactin. Actually, in males, in us men, we can have erectile dysfunction, because we saw that one of the functions of prolactin is that it assists in testosterone secretion. So erectile dysfunction, and of course reduced shaving habits and so on. Now, we need to understand what is causing high levels of prolactin. What is causing this monster? Because we cannot understand its treatment. We cannot treat it when we don't know the cause. So, one of the main causes of increased prolactin levels is drug-induced. Actually, most of people that are having high levels of prolactin are on some drugs, especially the antipsychotic drugs. The antipsychotic drugs, you find someone has a psychological problem, a psychological issue, or a psychiatric problem. They go to a doctor, they give them some psychotic drugs. Even simple drugs like amitriptyline. Simple drugs like amitriptyline can cause drug-induced hyperprolactinemia. So think about that when you are taking drugs, when you are taking antipsychotic drugs, they can cause that. Another problem, another disease that can cause increased levels of prolactin is the polycystic ovarian syndrome. In one of my videos, actually I was with Dr. Amarach from Nigeria, we discussed about polycystic ovarian syndrome. We looked at its symptoms and how it can cause infertility and how we can go about polycystic ovarian syndrome. Check out that video. But now, this polycystic ovarian syndrome is one of the contributors of high levels of prolactin. A disease called hypothyroidism, or what we call the goiter. We studied that in primary school. Low levels of iodine cause goiter and so on, all that. So hypothyroidism is one of the main contributors for high levels of prolactin. We also have what we call the prolactinomas. These are tumors. These are brain tumors. Actually, these are tumors that are found in the brain. These are tumors that can be found at the hypothalamus of the brain. They are benign tumors. And these benign tumors, when a tumor is an overgrowth, it is an increased, like when you have a tumor, you have an area of the body that is growing at a faster rate. When it grows at a faster rate, it forms a mass, and that is what we call a tumor. So if there is a tumor at the pituitary gland, at the area where the prolactin hormone is secreted, then we shall have increased levels of prolactin. Then we also have vitamin D deficiency. If you have vitamin D deficiency, we can have high levels of prolactin. Then we also have physical and psychological stress. People who are under physical stress, psychological stress, they have depression, ABCD, psychological issues are affecting them, their levels of prolactin can increase. And lastly, we can have CKD. CKD is chronic kidney disease. So if someone has CKD, it can contribute to high levels of prolactin. Therefore, if you found that you have high levels of prolactin, try to look around the cause. Try to go to the hospital. My fellow doctors, please try to identify the cause of these high levels of prolactin. Check the thyroid function, do the thyroid function test, check for deficiency, vitamin D deficiency, check for all those polycystic ovarian syndrome. Probably there may be a cause of this high level of prolactin, and we help a soul to get pregnant. So now, how are we going to treat hyperprolactinemia, high levels of prolactin? Because we've seen that it is going to contribute to infertility. By the way, a woman with it becomes so hard for a woman to conceive when they have high levels of prolactin. Very, very hard. Now, how are we going to manage this? Like I've already said, identify the cause. Find out the cause. We've talked about the causes above. Check. Do tests. For my patients, I think I just bias them with tests. Whoever comes, I want them to perform as many tests as possible. Why? I want to be sure. Even when something looks clear, even when something looks very easy, common, and so on, I always want to confirm, to do tests, do various tests, confirm the cause, and then treat according to the cause. So our treatment is going to be based on the cause. So treat the other causes, CKD, treat the hypothyroidism, treat the whatever, the disease, treat whatever is causing this. If it is a tumor, let the surgeons intervene, find a way of managing this tumor, so that we can have normal levels of prolactin. But whatever the case may be, we may need drugs that can lower prolactin. Yes, you're going to treat the cause. And at times you find it is idiopathic. Idiopathic. By idiopathic, we mean that no known cause. We don't know the cause. I usually tell people that when you find that the cause of the disease is idiopathic, it means that the doctors are idiots. They don't know the cause, because everything should have the cause. But there are those diseases, there are those conditions where a cause has not been identified. So now, even if it's idiopathic, so this is how we are going to be able to lower the levels of prolactin. How? Number one, we are going to use dopamine agonists. What are dopamine agonists? Oh, this is too much for you. So let's look at the drugs, the list of those drugs that are under the dopamine agonists, the drugs that will help us to reduce the levels of prolactin. Number one drug is leusuride. Leusuride is one of the dopa agonists. It's a very good drug, and it will be able to lower the levels of prolactin in your blood. Another drug is called carbagolin. Carbagolin, that is also a drug which can be used to lower the levels of prolactin. Another drug, this is very common, bromocriptine. I think most people have prescribed this drug, most people have received this drug, and it is one of the drugs that lowers the levels of prolactin. But of course, not the strongest. We have the carbagolin, which is very strong. Then we have a drug which is called pramipexole. 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 So this drug is also used to lower the levels of prolactin in blood. We have another drug which is called piribedil. Piribedil. When you go to the pharmacy, try to mention these words clearly. Piribedil. Pyrivedrine. So this drug will also be able to lower the levels of prolactin. I usually spell these words clearly because I know some of you are writing, and you'll be able to go to your pharmacies, to your chemists, to pick these drugs to lower the levels of prolactin. So there is also a drug which is called dihydroegocriptine. Dihydro, which is D-I-H-Y-D-R-O. Dihydroego is E-R-G-O, cryptine, C-R-Y-P-T-I-N-E. Dihydroegocriptine. This drug is also in the other class of the bromocriptines and so on, and it can be used to lower the levels of prolactin. And lastly, I will talk about a drug which is called ropinirole. Ropinirole. Ropinirole is R-O-P-I-N-I-R-O-L-E. Ropinirole. That drug can also be used to lower the levels of prolactin. Now, to answer the question which was asked, yes, high levels of prolactin or hyperprolactinemia can cause infertility, but it can be managed. Therefore, whoever has high prolactin and is infertile, is not able to conceive, please go to the hospital. Find your doctor, discuss. Trust me, this can be managed with those medicines I've talked about, and also looking at the causes, we can manage this, and someone conceives to have the gift of the womb. If you'd like to have a private chat, a private conversation with me, go to my website, www.druthman.com. Book an appointment. You'll be able to talk to me. We shall chat and find a way forward. Also, you can find me on all our platforms, Facebook, YouTube, Twitter, TikTok. This time we're also back on TikTok. So go there, you'll find our videos, watch, learn, get a solution to your problem. Do not forget to subscribe to this channel in order to be able to watch all the videos we give. I sign out.